How sleep affects your balance and what you can do about it. Hi, my name is Doug. I've been a physical therapist for 30 years and I specialize in helping people with balance problems learn to walk again. In this video, I'm going to discuss how a lack of sleep can actually affect your balance. Most people would agree that when you have a lack of sleep, your body just doesn't feel right. It's harder to be coordinated, it's harder to walk, it's just harder to function when you haven't gotten a good night of sleep. There have been several studies on this topic, and it should come of no surprise to anyone that when you lack sleep, your balance and coordination decline. In several studies, losing sleep for even one night in a healthy individual caused them to score so low on balance tests and coordination tests that they were actually at a high risk of falling. This is even true in younger people. Lack of sleep can lead to falls. So what can you do about it? Well, there are many different things that can cause sleeplessness, and there are probably too many for me to discuss in this video. But I'm going to talk about the things that really affect older people and what you can easily do about it. If you're still having trouble beyond this video, I highly recommend that you talk to your doctor and discuss why you're having trouble with your sleep, because it so relates to balance and falls and walking that it's really important that all of us get a good night's sleep. In this video, I'm going to discuss with you 5 things that anyone can do to prevent sleeplessness. The first thing is to regulate your circadian rhythm. Your circadian rhythm is a natural thing within all of us that helps us regulate our sleep and wake cycles. When we're young, we know that when the sun is up, we feel awake, and when the sun goes down, we start to feel sleepy. But as time goes by, because of busy schedules and work and lack of exercise and lack of exposure to sunlight, we can find our circadian rhythm is off. They've done studies where they put healthy people in a cave underground for weeks at a time, and within about 5 days, their normal sense of morning and night, of wake and sleep, deteriorates. Sometimes it gets so bad that the person becomes completely an insomniac because of the lack of sunlight. We need sunlight to help regulate our circadian rhythm. So one of the best things that older people can do to improve their sleeping is to expose themselves to early morning sunlight. It's recommended that when the sun is rising, you want to be outside, not facing the sun, but exposed to the sunlight, the UV light of the sun, to help improve your circadian rhythm. The pineal gland, which is in our brain, actually receives this UV light and helps regulate our own body's production of melatonin to help us feel sleepy later in the day when the sun goes down, because it all relates to sunlight. Getting regular exercise also leads to having better sleep. Study after study has shown that doing as little as 15 minutes of exercise per day leads to improved sleep. In fact, if you look at studies, the more exercise you get, the better you'll be able to sleep at night. And this is true for someone that's 20 as well as someone that's 80. Many studies have looked at why seniors have sleeplessness, and what they found is a lack of exercise is one of the most common and correctable problems. Now, you don't have to go out and run a marathon, but just going for a walk or being active, dancing, going for a stroll on the beach, even using a bicycle, anything like that, especially something that gets you outside, is going to be better for your heart and your muscles, but it's also better for your sleep. A very common cause of sleeplessness is medication. A lot of times the medication we take to help our hearts or prevent cancer or do any number of other things also has an effect on our sleep. If you're having sleeplessness and you're worried that it might be related to your medication, the best person to talk to is your doctor. This video is not long enough to go into all the different medicines and how they affect sleep. But I can tell you this. One of the biggest problems that people run into is by taking over-the-counter sleep medicines. A lot of times these drugs, which are similar to the drug Benadryl, which is an antihistamine, are anticholinergic drugs. While they do cause you to feel sleepy, they actually cause a lot of people to have difficulty with their balance, with their mental ability, and over time, it can even lead to dementia. There's a big recommendation with physicians right now to not give people over the age of 55 over-the-counter sleep medicines because we think that it might relate to increased incidence of dementia and balance problems. So if you're taking these to fall asleep, I really recommend that you talk to your doctor and see if there's any alternatives that might be safer for you. Anxiety and depression can also lead to sleeplessness. There are a lot of people that you can talk to besides your doctor about these kinds of problems. Getting counseling can help. In fact, a lot of people who are reluctant to go to counseling, once they go, find that it really improves their whole well-being, but also their ability to sleep at night. Having things that are in your mind that you just can't cope with, or anxiety, definitely causes sleeplessness. Another area that you can try is to try mindfulness meditation. That's a meditation practice that is very simple to follow, and it's something that if you look on YouTube or look it up on the internet, there's a lot of good sources of information and directions for how to do mindfulness meditation. Even doing it as little as 10 minutes a day has been shown in several studies to improve not only the number of hours that someone sleeps, but the quality of your sleep. In conclusion, sleeplessness can cause problems with your balance. Study after study has shown that when someone lacks sleep, even for just one night, it can not only affect their balance and coordination, but also increase their risk of falls. I hope you found this video helpful. Click the subscribe button if you want to see more videos like this. If you would like more help with your balance, look in the description for a link to a course I created that can help anyone improve their balance at home.